Workgroup Crucial Conversation Series. My name is Dr. Lorenzo Hopper, and I'm an assistant professor in the Department of Epidemiology and Community Health at UNC Charlotte. I'm also the co-director of the MCH Workgroup, along with my colleague, Dr. Elisabeth. We're pleased to bring you this conversation today in partnership with Mecklenburg County Public Health. Our topic is going to focus on partnering with early child care centers to improve early childhood immunization rates. If you're returning, welcome back. If this is your first time with us, thank you so much for joining, and we'll have information to stay connected with us. This is a great topic, and I'm excited for everyone to participate in today's conversation. We started this crucial conversation series as a space to engage in really important dialogue on various topics in MCH. And through the work group, we try to provide opportunities for collaboration, research and practice to disseminate our work and provide service to our Charlotte community. So without further ado, I will get to introductions. So our first speaker, we have Dr. Elisabeth Pordes, and she is a senior health manager for the Prenatal to 3 initiative. In addition to that, and I'll let Dr. Pordes talk a little bit more about herself and her role. She's a board certified pediatrician and is passionate about holistic, family-centered mom-baby diet care, community-driven and culturally humble approaches to improve early childhood development and address complex social and medical issues. So thank you so much, Dr. Pordes, for joining us. We have a co-pilot for today's conversation. We have Chandler with us. She works as the COVID and Mobile Response Unit Manager with Mecklenburg County Public Health. The mobile unit provides medical services in remote, underserved, and emergency areas. And I will let Kita tell us a little bit more about herself as well. You may utilize the chat box and the Q&A box throughout today's conversation to pose questions, or you can just jot them down. We'll save some space at the end to engage with everyone. At this time, I'll stop sharing my screens and turn the floor over to our speakers for the hour.
Thank you for that introduction. Please let me know, can you guys see my screen? Okay,
we are great.
Good. So again, my name is Liz Pordes. I am with Mecklenburg County Public Health. I am a pediatrician by training. My specialty is with children and infants with medical complexity. But today I am going to do a presentation with both my pediatric hat and then also my public health hat. And although Dr. Hopper said that Keto is my co-pilot, she's really the pilot when it comes to immunizations. And she has taught me so much about understanding immunizations from a population perspective, as well as how we can work with our healthcare providers, our entire healthcare ecosystem, and our families to really improve outcomes for kids. So first, thank you guys for letting me speak today. And as you'll see, for this work, it is really a team effort, and I have partnered with a lot of people within public health and then external partners for this work. On here are 3 QR codes. One is to our communicable disease team, which really led this work. One is to our immunization clinic. And although I have the word clinic on here, they do a lot of outreach with Kita and her division as well, and then a link to our Prenatal to 3 strategic plan. So that plan is my main role at the Public Health Department, and it is a relatively new county plan to improve outcomes and reduce disparities in health and education for the prenatal to early childhood population. And this immunization work directly relates to that plan. One of the goals is optimal child health and development. And we really can't have healthy kids that are able to develop healthily if they are getting communicable diseases that could be vaccine prevented. And lastly, I just want to acknowledge all the people in public health, our schools, and our federal response team that is continuing to work tirelessly in Western North Carolina to keep our kids safe. And kids are still needing immunizations in that part of the country. So addition to Keita and I, this is our NACHO grant team and really demonstrating the power of collaboration. And then the leadership with Dr. Bonnie Coyle and Dr. Raynard Washington. Most of us on here are in different buildings, different programs and departments. This runs from the communicable disease, child healthcare consultants, the mobile response unit, the Prenatal to 3 initiative, and public information. And then there's ongoing work by our immunization team. And then our key partners in this work was our early childcare centers. So the work I'm going to talk about today focuses on early childhood vaccines and relates to the goals in the Prenatal to 3 strategic plan as discussed. In my day-to-day life, I often take vaccines for granted, so I wanted to center us on this stance that childhood immunizations is one of the greatest accomplishments of modern medicine. In a research paper from 2014 in pediatrics, it was felt that if you took the 2009 US birth cohort, so within our own country, routine childhood vaccines prevents 42,000 early deaths, 20 million cases of disease, with a net savings of $13.5 billion in direct costs, so that's healthcare costs, and $68.8 billion in total societal costs. So we know we vaccinate our babies and children to be able to teach their immune system how to recognize a virus or bacteria. On the left of your screen here, this is an infographic from the American Academy of Pediatrics, really designed for families. We know that vaccines build long-term protection against disease, and that we are not only creating individual protection, but also protecting our community, called community immunity. So protecting those that can't get vaccinated, whether or not they have a underlying disease, like some cancers cannot be vaccinated by certain vaccines, or really they're too little. A lot of our babies can't get a lot of our routine vaccines. And so we know we vaccinate our kids to keep them safe and healthy so they can grow and learn and do all the fun things that kids like to do. So to move over to the child care facilities, the North Carolina Immunization Branch has requirements for our child care facilities for immunizations for children in the facilities. And as you can see, this table shows by age what vaccines the children need to be within that child care facility. And so these are the regulated facilities. And just to point to the green box and the purple box, so the green shows the pertussis vaccine. And as of September, we had about 40 cases of pertussis in Mecklenburg County. And then the purple points to our measles, mumps, and rubella vaccine. And we've had 1 case so far in 2024 with measles. When we talk about these vaccines and the diseases that they've presented, as a pediatrician, I have seen these diseases. I have seen very small infants come in that have stopped breathing because of pertussis. When we think of pertussis, we often think of the whooping cough, that funny cough sound, but when babies get it, it makes them stop breathing. And I've seen babies that have died from pertussis, and they often will get the pertussis from a family member or someone they live with. So really, vaccines are important for all of us to protect our most vulnerable. And then I have also seen measles, and I have seen a rare but very serious side effect of measles where it affects somebody's brain and causes them to have brain issues, brain swelling, and then developmental and movement concerns. So this is a map of immunization rates within our own county. And the stars here show our 4 zip codes with the lowest immunization rates. Nationally, for kids born in 2021 at 3 years of age, about 66% are up to date with their routine childhood immunizations. And for that same cohort in North Carolina, it's about 77%. Our vaccination rates when we pulled this in the winter for those few months was closer to 60%. vaccines. And two things I want to draw your attention to is one, the goal for community immunity is 90%. And for some of our diseases, so pertussis and measles, it's closer to 95% of people to have immunity or vaccines to that disease. And then the other thing is that the areas that we are seeing our lowest vaccine rates are not the same areas where we have our highest levels of poverty or other poor health outcomes and disparities that we typically see. So these are different zip codes, and in some of these zip codes, we have higher average incomes. So now to move to the NACCHO grant, the background and objectives. So the NACCHO grant team, Kate and I, we applied for this grant in the winter of 2024. It was initially a 9-month grant, but it's now extended and has over 10 different areas of the country receiving the grant. So specifically, the grant was looking at expanding vaccine coverage through partnerships with early childcare centers and programs. So this grant really came out of work by NACCHO, which is a public health national organization, based on some listening sessions that they had with early child care centers after and during the COVID-19 pandemic to really solidify the relationship and partnership between local health departments and early childhood centers, knowing that both of these departments really are infrastructure for our society, our early childhood center and our health departments. And how can we best work together, collaborate, and improve childhood outcomes? And so NACCHO is working on a toolkit for local health departments and early childhood education centers to talk about building the partnerships. So our grant has 5 specific objectives, and understanding that the grant was made to build off of this work of partnerships between health departments and child care centers. That is one of the main tenets or objectives of the grant, is to establish these partnerships, reach outside local health departments into the community to build collaboration and understand current barriers and opportunities for collaboration. We also have to develop community-specific solutions and activities to improve vaccination outreach and access for kids under 5 and their families to vaccine, disseminate and create key messaging, participate in peer learning networks. So we have quarterly meetings with the other grantees. And then we provide to NACCHO's shared learning by providing reports on our challenges, our successes, and our outcomes. So the really unique thing about this grant is we are not just looking at the primary long-term goal outcome of improving immunization rate. We're really looking at everything along the way and the entire process. So why does NACCHO want to focus on early childhood centers for immunizations? So there's several reasons for this. First, early childhood centers are already invested in child health and development. This is something they do day in and day out. They have trust and family partnership. They have a high frequency of family interactions. There are state regulations for immunizations. And we know that they are a backbone of our society. And without our early child care centers, we are losing support for our family. People are not working in their jobs. And we just, the downstream repercussions that we saw during the pandemic when our early child care centers were either closed or not supported. And just to highlight that right now, we are in a child care crisis in terms of funding, both within our state and within the country. The other thing that was pretty impressive to me about childcare centers is just how embedded in our communities they are, and especially in our communities that have higher rates of childhood poverty. So this is actually a map that was done through UNCC for a landscape analysis for the Prenatal to 3 strategic plan. And so on the left, you can see a map of all the medical services. The brick and mortar services are in the black dot, and the darker the blue is higher levels of poverty. And so you can see our medical services are pretty concentrated in our uptown to even our South Charlotte area, and pretty disparate in our eastern and western in that crest of Mecklenburg County. Now, contrast this to our pediatric 4 to 5 star childcare centers. They are really everywhere. And as you can see, they are concentrated in areas of high childhood poverty. So to reach families, these childcare facilities and providers are a great mechanism to interact with families and really understand what is going on in communities. And these childcare providers are really doing the work within their community. So for our grant, specifically in Mecklenburg County, we built upon our existing robust connections with early childhood centers through the childcare health consultants led by Lawanda Convo. So what the childcare health consultant program is it is a team of nurses that assists licensed childcare centers with policies and procedures that improve health and safety of kids 0 to 5. And so this team already has very robust connections with over 200 centers within Mecklenburg County, both to help ensure that the childcare centers are following policies and guidelines set by the state in terms of cleanliness, different communicable diseases, but then also to offer consultation and help if, for example, a child care center does have salmonella or some other concerns. And so this child care health consultant team is really trusted within our child care community. And I would say is really an advantage that our team had for this grant that a lot of other jurisdictions did not already have that partnership. So in our grant, we did a messaging campaign. We did outreach and community engagement activities, which our immunization team already does a lot of. And then we worked specifically with immunity champions from childcare centers in zip codes with lowest vaccination rates. And they received a stipend for their time. We really wanted to acknowledge and appreciate what our childcare providers do for our communities and our kids. They're often underfunded, underpaid, and underappreciated. And so we really wanted to hone in on this aspect of our partnership. So for our immunity champions, these were often, as I said, the directors of the different childcare centers. They helped design messaging campaign. So they helped pick exactly how the campaign rolled out, what type of imagery we reused, what type of messaging we should use. And then in addition to their stipend, they attended short virtual meetings, and then they participated in education and strategy options. They provided vaccine rates for their own center, and then they had open communication. And I know our communicable disease team and our child care health consultants team received a lot of phone calls and individual questions. On the right here, you can see from one of our webinars that was led by our intern, Emily Faulkner, 3 different strategies that the immunity champions could pick from. They could either give educational information sessions to families with the guidance from our team. They could do individual coaching, where if they had specific situations with families or concerns from families about immunizations, we would coach them through that. And then they could also create a recurring reminders, and then also set up billboards or a media campaign. So every child care center got an immunization packet that Emily had put together, both in English and Spanish. And then among requests, we could translate to other languages. Some key things to point out about these packages that we designed is it was not just the basics of what immunization your child needs, but where to get immunizations, how to address anxiety in infants and toddlers for vaccines, why adults should get vaccinated, and then what are the vaccines during pregnancy as well. So these are some of the things we're most proud of. We worked with Liz Graham and our public information team to create some of these messaging campaigns that you guys might have seen around our community, and we really focused on our areas of the city with our lowest vaccination rates. Some of the information that our immunity champions told us is they wanted a quick, easy checklist like campaign that showed some of our younger students. So as you can see here, it just says first day of school checklist, get vaccines, say cheese, and then a QR code to our immunization page. These messages were in English, Spanish, and then Ukrainian. We also had some radio ads. We had some geofencing, so people would get ads on their phone if they were in certain areas, as well as billboards and chalk messages. So these are some real life examples. And our public information team is helping us analyze data of how many people clicked on the different ads that we put out through our geofencing. And so far we've had over about 800 clicks. And then how many people drive past our billboards, and those are in the tens of thousands. So our preliminary findings with our grant, our parents seem to be receptive of information on vaccines from early childcare providers, and this may influence vaccine choices. So we did have some of our providers reach out to their parents to ask, did receiving the resource packet or seeing the posters move you towards getting your child vaccinated? And only preliminary of the 5 responses we've had, we had 4 people say yes. This type of messaging from this source influenced their decision. The second thing is kids in our cohort had higher than population level rates. Like I said, so our county population rates are about 60% up to date, but in our childcare centers, it's closer to 80%. And that is so much closer to our community immunity numbers. So we really know that our childcare centers and our families that are part of these centers are really working to help keep our kids safe and healthy. And then our immunity champions prefer strategies that are less time intensive. So the majority of our champions chose the strategy where they would do recurring reminders or bulletin boards instead of one-on-one coaching or education sessions. So overall takeaways is that vaccine compliance is important for our immunity champions. Some of our seasoned directors of childcare centers were well-versed in vaccine discussions because they had to have them during COVID-19 with their families. The existing trusting relationship between the health department and our childcare centers and the childcare centers and the families is key to this work. Our childcare centers have higher vaccine rates compared to their general population. Our childcare centers are passionate about this topic, but they are very busy. And so we need to make education on this easy, convenient, and efficient. Anecdotally, childcare centers are seeing increasing numbers of religious exemptions for vaccines. Passive messaging from trusted sources seems to have a positive effects on vaccine habits. And our Spanish language ads had more engagement than our English language ads. And another key finding, our intern, Emily Falconer, with Healthcare Connections, she was amazing. So on here is a QR code for the Health Carrier Connection program, and they partner with colleges to bring interns to different healthcare careers, and they help fund them for those careers. So our next steps is to continue working with our immunity champions through the viral season to figure out how we can reach kids that are not enrolled in our ACEs, and then congratulate and uplift the work of our childhood centers on this important issue. And thus, really quick, while I have you here, I just want to talk about 2 vaccines that relate to maternal child health work, the HPV vaccine and the RSV vaccines that were not part of our grant, our routine childhood vaccines for the early years. So the HPV vaccine is a routine childhood vaccine. It is to protect against cancer-causing strains of HPV. This is recommended to give to kids 9 to 12. It's more efficient and effective at earlier ages. Preteens produce more antibodies to the HPV vaccine. And although HPV is often related to a sexually transmitted disease, we know that people can get HPV other ways. And so really getting kids early is helpful. And then we see that there's low rates of uptake of the HPV vaccine in our country, and that there's very significant disparities by insurance type, where you can see with private insurance and Medicaid, there's a 64% vaccine rate, but our uninsured kids is only 38%. And these are just some infographics, but pretty impressive that the HPV vaccine protects over 90% of cancers caused by HPV. And then lastly, our RSV vaccines and our RSV immunoglobulin. These are relatively new, and I think it's important for our community to understand they exist. We recommend that pregnant individuals talk with their healthcare providers about the new RSV vaccine. that can be given at a certain window between 32 and 36 weeks during RSV season, which we are in right now, and that there is a new-ish RSV immunoglobulin for babies. We used to only give this for really high-risk premature babies or babies with heart disease, but now all babies can get it. And it's really reduced the risk of babies being hospitalized for RSV. So RSV is a virus that causes bronchiolitis, so babies have problems breathing. Some babies can stop breathing, and I have seen healthy babies that have died from RSV. So knowing that we have vaccines and immunoglobulins for this virus is very important to spread within the community. So now I'm gonna turn it over to Kita to do a deeper dive in immunization rates with Meck County and what our public health department is doing. Kita has a wealth of knowledge and has worn a lot of different hats in the immunization world to really improve rates within our community.
All right. Good afternoon, everyone. As Liz said, my name is Keita Chandler. I am currently a program manager here at Mecklenburg County Health Department. I currently manage the mobile outreach program, which is a program where we have 2 mobile units that go out into the community, and we take health services to areas where there are deserts, the health deserts, like Liz said before, and we offer childhood immunizations, adult immunizations. We also do STD and STI testing, as well as we give out Narcan. I am also the manager for the COVID response unit with Mecklenburg County Health Department. As much as we would like to think that COVID is no longer a thing, it will always be a thing with us. And therefore, my department is still fairly busy. And part of some of the things we do in our department is that we do have vaccine clinics where the community is able to come out and get their COVID and flu vaccines, as well as we do administer COVID tests at all of our libraries and all of our community centers associated with the health departments, as well as we do have other areas where you can come and get free test kits and masks from the health department. So that's a little bit about currently what I do with the health department. Previous to that, I was the regional immunization consultant for this area with the North Carolina Department of Health and Human Services for about 16 years. So that is where my wealth of knowledge about immunizations has come from. All right, so let's get into some of the good things and the bad things and the ugly things that are associated with childhood immunizations. So here, every year, each state, based on the Healthy People Initiative, and I'm not sure if you guys are familiar with the Healthy People Initiative. Currently, we are in the Healthy People 2030 Initiative. The government, the CDC, the World Health Organization, they come up with numbers and goals that they want us to meet based on different health disparities. And so the goal for the Healthy People 2030 goal for immunizations is that 90% of all children in the United States will be vaccinated by the time that they're 2. So every year, the Department of Health and Human Services here in North Carolina, we do an assessment of how well we're doing as a state, and then each county receives an assessment, each health department receives an assessment, and then each private provider receives an assessment, and that gives us our numbers to let us know how well we're doing in terms of meeting that 90% goal. So the information that I have here for to show today shows the annual assessment from 2023, and you guys will be able to see here. We don't look at all the childhood vaccines. We look at the ones that are required, mainly for daycare, for school, and the ones that we have the most outbreaks related to. So you'll see here For this, we're looking at the 4 doses of DTaP, 1 dose of polio. We're looking at the 1 dose of MMR, and so forth. So I won't read it all for you guys because it's all here for you to see. But those are the vaccines that we're looking at. Each health department is assessed October of every year. So that's when the assessment numbers come out. Typically, the state doesn't come out to discuss that information with the health departments until the beginning of the year, but the assessments come out in October because that's typically after the time when we have the most uptake in people coming in, like back to school time. So a lot of people who may not be up to date on their shots are pushing to get their shots up to date by October. So you can see in the state of North Carolina currently, as of last year, there was 129,000 children roughly identified in that birth cohort. As a state, we were only 71% up to date. And again, all of this information is pulled from the North Carolina Immunization Registry. So it's the information that we put in there when people come to the doctor's office and the health department to get their vaccines. And then you'll see that the state up-to-date rate is 91,000. So about 91,000 children in the state of North Carolina are up to date. And up to date means that they received their shots on time based on their age. So it doesn't take into account all of the children who are receiving their vaccines late, because we do know that sometimes there are things that prevent people from, getting their vaccines on time. The only rate that they're looking at is that up-to-date rate. As you look here on this map, the map shows us based on all 100 counties in North Carolina, because there are 100 counties in North Carolina. That shows us the up-to-date rate by county. Anything that's in the gray range, their up-to-date rate was like less than 30 to 40%. Anything in the light blue range was around 15%. And then I know it's kind of hard because of the color, but the lightest of the blue represents all of our counties who had 71% or higher of up-to-date rates. Now, some of the counties on here actually do have 100% up-to-date rate, and those would be our counties where we have a smaller population of 2 to 3-year-olds. So like a county like Anson County may only have about 32-year-olds, and all of them go to the same daycare and all of them go to the same doctor's office. So they're all up to date. So their immunization rates are going to be a little bit higher, opposed to when you look at a county like Mecklenburg, where we have 17,000 2 to 3-year-olds and, God knows how many, daycares and how many providers. So a lot of times, in areas like this, our up-to-date rates are a little bit lower. If you look at the other side of the demographics that I shared, it also shows, this is the information for Mecklenburg County. Like I said, we roughly have about 17,000, so 16,000 2 to 3-year-olds. Out of those 2 to 3-year-olds, only about 11,000, almost 12,000 of them are up to date. And you'll see that the up-to-date percentage is about 71%. So only 71% of our 16,000 2 to 3-year-olds are receiving their vaccines on time. And so the importance of that is that, as Liz said previously, in disease prevention, the more children that are receiving their vaccines on time decreases the amount of children that we have to worry about being exposed to vaccine preventable diseases. The information here also breaks down, the NCIR also collects information about ethnicity, race. They just started collecting information on gender, so the next assessment will have some of that information in there. So it gives you a pretty good idea based on the map that Liz showed earlier in the areas where we have the lowest population of children. It also shows you, the breakdown in ethnicity and race of who's truly, coming to be vaccinated and who's not. So if you look at this, it's the complete breakdown all the way to the 100 and it looks like 100. I'm sorry, it's little and I don't have my paper right here, but you can see all of the children that have been vaccinated and the children that haven't been vaccinated. All right, next. So here, just to kind of give you guys an idea about what we've been doing here in Mecklenburg County over the last 10 years, we keep track of how well we rank up against, the state averages, all of the state, local health department averages, and then what we do as a county and what we do as a county health department. So if you look here in this chart, you'll be able to see the trends, how like back in 2013, the statewide average was about 68% of people that were up to date. 86% was the local health department average. You'll see that Mecklenburg County at that time was about 68%, which was what the statewide county average was. And then as a health department, our rate was about 73%. So what this allows us to be able to do is to kind of see trends, and it allows us to be able to create programs and partnerships to help us target areas, not just within Mecklenburg County, but also around the state and the state health departments to try and help us increase our overall immunization rates. For the most part, you'll see as a health department, typically health department rates are a lot higher. And that's particularly because most of the people that are coming to the health departments are coming there for vaccines. There's very rarely, anybody that's going to come to the health department and say, I don't want a shot. They're coming there because they need that service. So traditionally, the numbers at the statewide health departments as well as the local health departments tend to be higher than when you look at the county rates, and you'll see the county rates are a lot lower because what that does is that's a composite number of all of the doctor's offices, the hospitals, anybody within a county that administers vaccines, the numbers are included in there. So the numbers will be a little bit lower because we do have some providers that don't participate in the North Carolina immunization registry. So they're not inputting that information to the NCIR, so we don't grasp that. And then, it's just turnover also has an issue with that because people, again, are not putting that information in there. So our goal, as you can see for last year, the health department's rate was at 65%. And one of the major reasons why that was is now we're getting that fallback from COVID. If you look in 2020, you'll see that our rate was 93%. And that's because we had less children to assess coming into the health department, opposed to now the numbers are going back to like pre-COVID numbers where we don't have as many people. We have more people coming into the health department and less people being vaccinated overall. Next. This right here also is the complete breakdown. So this is what we receive from the state when we get our assessment. And each provider actually receives an assessment just like this, along with the health department. And so what it does is it breaks down the birth cohort, which is our 2 to 3 year old group. It tells them the date, October the 1st. It shows the vaccines that we're looking at, as I stated earlier, like the 4D tabs, the 3 polios, and so forth. This is, so you'll see for Mecklenburg County's health department, we have 446 children that we've seen at the health department between that age group, and only 65% of them got their shots on time. And so, again, as you can see down here, the goal is 90%. We do have a county goal of 80%. That's just our own personal goal to try to reach, but the CDC and the Healthy People 2030 goal is that 90% of all our children are vaccinated by the time that they are 2 years old. So you'll see here that information. That's okay. You can go to the next one. So to talk about what we're doing here at Mecklenburg County to try and increase those numbers along with the NACHO grant is that we also have an annual plan for protection here in through the mobile outreach program as well as our immunization department. And so in the fall, we focus on taking the mobile unit out to for children and for young adults. And so we have an initiative where we're getting kids ready for back to school and offering them all of the vaccines that they need. Sorry, it says my internet is unstable. Can you guys still hear me?
Yes.
We can. It's just
we
breaking up a
can.
little bit, but we can hear you.
Yeah.
Hello, hello, hello. Oh, okay. Okay. Yeah. Okay. Sorry about that. And then in the winter, is our focus on older adults. And so, as Liz talked about earlier, when we did education for the grant, where that your children and small kids being vaccinated, but adults also need to be vaccinated so that they can help with immunity, because we know that there are a lot of babies that aren't able to be vaccinated because of age. And so by us ensuring that adults and different people in the family are vaccinated and up to date their vaccines gives the smaller children a better chance of having that coverage that they need.
Kita, now we can't hear you. Maybe try turn off your camera.
Can you hear now?
Yeah.
Yes.
Okay. Is that better?
Yeah.
Can you guys hear me? Yeah, I'm sorry. I'm in an area where we don't have good internet service. I'll try to be. But as you can see, we focus summer elementary, and then in spring, this is something that we're doing new, where we're doing more outreach to babies as well as birthing people, parents to be, because as Liz stated earlier, letting people know the importance of ensuring that the mothers and the birthing people, the birthing families are all up to date on vaccines. So as you can see on the side of here, we do run a report from the NCIR, which gives us a list of children and people that come to the health department that are not up to date, and we're able to follow up with those people based on that information. So that's something else that we're doing here. We also go out and provide education in the community with community-based organizations, faith-based organizations. We go to schools. We target a lot of senior nutrition programs and so forth. So you can go to the next one. This one kind of is very similar to what I just talked about. It just breaks it down a little bit. That was more focused on the mobile unit and what we do in terms of going out into the field. This is our focus more so within the health department, with us running that report that I talked about with the NCIR. We also use these services in outbreak mode. So as Liz talked about earlier, having outbreaks of measles and things of that nature, we're able to run reports that will give us a list of all of the children within Mecklenburg County that haven't been vaccinated with MMR or Hep A or whatever the vaccine is. And we're able to send out correspondences to the families to let them know, hey, your child is not up to date on this particular vaccine. We're in outbreak mode. You want to try to bring them into the health department as soon as possible or get them an appointment with your PCP. Next. Liz also talked about earlier our HPV numbers. That is one of the vaccines that has been low participation overall. I think because it's one of the newer vaccines, a lot of people don't understand the importance of what HPV does actually do for the people that get it. And so we wanted to add some cool tidbits for you guys to be able to share with people. Talking to parents about HPV vaccine is a really great resource for people to use in their at the doctor's offices or going out into the community, because it answers some of those questions about, it's not it's not just about sexually transmitted infections. It's about, preventing cancer. It's cancer prevention, and that should be the main goal in getting people to understand the biggest reasons why we need people to be vaccinated against HPV. This iceberg is one of the coolest things that I ever seen in terms of educating people about it, because it goes into letting you know, like, this is how many people on during a year are affected by HPV, and then the different cancerous and precancerous things that happen from HPV, because a lot of people don't understand they just think HPV is something that you get and they've been told that it goes away, but they don't understand that it does cause throat cancer and anal cancer and vulval cancer. And so these numbers help put into perspective how many people a year are actually affected by HPV, and that 90% of these could be prevented if we started vaccinating our children at an early age. So, for anybody, that needed some extra information and talking to parents about the importance of HPV, these are some very good tools. Because a lot of moms of boys don't understand. They're like, oh, I heard HPV is a girl thing, because there's not a screening, to be able to screen for it. But this is how it can affect your son if they are infected. So we just kind of wanted to give you guys some information, because we really do have low HPV rates now, because it's not a required vaccine, it's a recommended vaccine. And a lot of times when people go to the doctor, they're like, okay, what vaccines do my children need? And they're only really getting information about the ones that are required and not the ones that are recommended. And so, in talking to people, it's very important that we discuss things like HPV as being something that is not necessarily required, but it's detrimental, to be able to decrease the amount of cancers, that our children are exposed to. And I think that was my last slide.
Thank you, Kita, so much for that. I just want to give you guys some more resources. This is the Mecklenburg County Public Health Immunization Clinic, so it does offer free immunizations, and then sliding scales, free for kids. The Vaccines for Children program, VFC, this I just learned about, that it was created in 1993 after there was a measles epidemic, and the CDC found that about half of the families who were not vaccinated, it was because of the cost. So the VFC has been created, and this is its like a little over 30th year. That's no cost childhood vaccine. So that's for kids who are uninsured, kids who are underinsured, and kids on Medicaid or Medicaid eligible. You can all get free vaccines. And then the last resources I have are just childcare assistance in our county. So Childcare Resources, Inc. helps with childcare subsidies and childcare placement for families. And then our MEC Pre-K program provides free 4-year-old pre-kindergarten for our county. And then my call to action for everyone is just to check your voter registration if not already done that, and make a plan to vote.
Awesome. Well, thank you so much for all of that information. It's so critical to have these conversations about child immunizations and increasing awareness about the benefits and combating some of the misinformation that does exist. We'll hold the floor now for a few questions. If you'd like to unmute yourself or drop a question in the chat for either of our guest speakers.
To answer the question about what additional ways can HPV be contracted, so it can spread from skin to skin contact as well. And then definitely for babies that are born, if they're like vaginally, if there is some HPV lesions, babies can also obtain it that way. I think we're still starting to learn more ways that HPV can be transmitted, especially since we're seeing it might be other types of transmission, especially as we're seeing like throat cancers related to HPV, and mainly like that skin to skin contact. Kita, do you have more information on that? Because I agree that the general teaching, like what I was taught when I was in residency in medical school, was sexually transmitted. But we're finding HPV has a role in more cancers with more
So,
research.
yeah, so HPV, like you said, it is a skin to skin contact. If someone has, if we were sharing gym shorts, and I had HPV, it could be spread that way. It could, if you have it on your hands, your lips, it's not just a sexually transmitted infection, because it is skin to skin. So, if we're involved in a sport, and I have an active case of HPV and our skin, touches, then, now you're, possibly infected with it. So, um, that's the reason why, getting kids vaccinated earlier than later really does assist with, decreasing the amount of exposure they have to HPV, because it can be exposed from hand to hand. It can be exposed from skin to skin. It can be exposed from sharing, intimate items, which we know some kids do. Hey, I left my gym shorts. Can I borrow yours? Now you got a parent who doesn't even understand how my child could now have HPV, and they're not sexually active yet. And so that's the thing that we need to make sure that we're educating people about, the importance of getting people vaccinated and educated about what HPV truly is.
Thank you for those responses. One question from me, what role do you both see for us as community, as faculty, researchers, students, healthcare providers? What role do we play in helping to support your initiatives and build trust around childhood vaccination?
For me, I really employ people to become educated about vaccines outside of what their providers tell them. Um, a lot of what we know as a population has been provider driven. And so a lot of times, depending on where you go to the doctor and what the initiative of your provider is, you may not be getting all of the information that you need about what your child needs at that time. So I think, just ensuring that we as a community and population are educating ourselves on the importance of what vaccines we need and when we need them are also important. Because if you go to a doctor's office who, based on, Medicaid is on an alternate schedule, then your child may not be getting what they needed, because that office is on an alternate schedule. So it's important for us to teach each other the importance that the provider is telling us that we need.
Thank you for that. Shanique, I see you have your hand raised.
Yeah, I have another question. What is the protocol when children are diagnosed with measles and those occurrences where that's happened in the county? So a mom comes in to the pediatrician and, oh my gosh, the child has measles. What direction is given to the parent? And then is the county responsible in any way of making the community aware?
Yeah, that is a great question. So our communicable disease team, that is that team, a lot of what that team does. So pertussis, measles, those are reportable diseases. So when there is a child or someone who has that disease, it has to be reported to the public health department and to the state. And so the communicable disease team, it does go and meet with the families and talk with families, and it does to see, has anyone else been exposed, and then provide information to those individuals. And I think it really depends. My understanding, because I'm not part of that team, I have not had those experiences, is it's really a case by case basis. So if there is a large community exposure, then there will be a large community education and discussion. If it's a much more isolated exposure, then there won't be.
Thank you.
I
Thank you
will
for
say
that.
too, if you could, part of what my team does with the mobile unit as well is when we are in outbreak mode like that, because we had something similar last year. We actually went to a daycare where we thought we had a possible exposure. And we, educated, the daycare. We tested people who, may have been exposed. So we do outreach when there are exposures like that as well in the community.
Thank you, Keita.
You're welcome.
Thank you.
Dr. Dahl.
Yeah, I had a question. It sounds like the county is doing fantastic work with these partnerships with early childhood centers. And I was just thinking about, since COVID, some of the conversations that I've heard in the community around like the rising costs of childcare and it becoming increasingly inaccessible for families for certain reasons, and also a provider shortage in some of those centers. My question becomes, what is the health department doing to reach those who are not in early childhood education centers? If you could just give me like one or two examples of what's happening to reach those families that aren't integrated into those systems.
So part of that list that we talked about, that the county runs when we get our assessment, we have a team. Now this is only if so that child is in the NCIR. So we can only reach children when each child is born in North Carolina. Vital Records automatically feeds them into the NCIR once they get that the birth dose of Hep B. So typically we have all of the children in North Carolina. The health department has a team that runs a report, and it gives us a list of all of the children who are not up to date on their vaccines. And we proactively send out letters and to all of those families. Now, the state also charges each provider to do the same thing for children that come to them as well. So families that have kids that are not up to date, they typically should be getting correspondence from the health department because we recognize that they're not up to date, and they should also be getting correspondence from whatever provider's office that they go to not be up to date. We've also been partnering with WIC, because we know a big population of that group comes in. And so we're having WIC pool children that are not up to date on their vaccines as well to try and catch them, at that age as well. We're partnering with some of the Medicaid programs so that we get pregnant birthing people information prior to them having children so that they'll know, hey, when you're bringing your kids in for this, they should be vaccinated. If you have kids so those are some of the things that the county are doing currently to try and reach everybody.
Awesome. Well, we are coming up on the 1 o'clock hour. Again, I want to say a special thank you to our guests for being here and sharing all this information about what's going on around us. Just a few announcements before we go. The Greater Charlotte branch of the Diaper Bank is accepting donations. And so we have a QR code here, and just stay connected with us through our newsletter where we'll share opportunities to engage with future crucial conversations and efforts such as this one. Without further ado, I think I would just like to say that I appreciate your attendance. Continue to educate yourself as our speakers have promoted us to do. And thank you again for joining. Take care, everyone.
Thank you. Bye.
Thank you.